So this is a bit personal, but I'm going to tell you about it because it's like regular everyday stuff. And this is how being a witch or on this spiritual path can apply to the everyday mundane things. So I just had the most frustrating doctor's appointment ever. My normal healthcare practitioner she's having her own health problems. And so she hasn't been able to see me this month. She actually needs a kidney type O, if anyone knows. And I have to go in every 3 months to get my ADHD meds refilled and my other medications. Wasn't able to see my normal practitioner. And I was nervous about seeing the doctor because I don't like doctors. But I've been having some issues over the last year with like perimenopause stuff. I'm 40, almost 43 years old. It happens, right? And I'm 100% sure that it is perimenopause. I'm not going to go through all the symptoms, but very fucking sure, okay? And my other practitioner told me that like doing a hormone test is like trying to hit a moving target. You can come in the morning fasting, do your hormone test, and it could read totally normal. We have to go on symptoms as well. This doctor I saw today didn't think so. First of all, she tells me, you're too young for perimenopause. First of all, are you looking at my chart or are you looking at me? I do get told often that I don't look almost 43. I don't know. That's not why I'm here. But she tells me I'm too young. Bitch. She asked me when my mom went into menopause, and I said, I don't know. My mom had a hysterectomy because of endometriosis at like 40. I don't know. Oh, so there's no record or no history. No, but I'm telling you all these things that very much align with perimenopause. Anyways, besides the point. She orders a hormone test. Great, grand, wonderful. I'll go in on Wednesday. I'll do that. That's fine. It's going to come back normal. They're going to tell me nothing's wrong. Then she gets to my ADHD med refill, and she didn't like it. Because you see, I'm on 2 medications. I'm on one that helps with ADHD and kind of eating issues. And then I'm on a second one, a very low dose of a second one, just for the end of the day. Sometimes I split and I'll take half in the morning, the regular med, and then half in the afternoon. It just depends on the day. It also helps with all the ADHD med shortages that happen all the time. So I've always got at least one available to me. Anyways, this has been working for me for a very long time. This doctor doesn't like that. She hums and haws, doesn't want to refill a prescription, tells me that she'll fill it for 1 month, but I'm going to have to come back and see the other practitioner, who I don't know if she's going to be there because she literally needs a kidney. Left this appointment incredibly frustrated and upset and angry. And whenever I'm frustrated and upset and angry, I hate sitting in that. Because sitting in uncomfortable feelings is fine, but when it's anger and frustration, I know that there is a solution to that. This is where witchcraft comes in, because this is where our power comes in. When we feel that we haven't been heard, and when we are frustrated and we are angry, the answer to that for me is always action. There is a solution somewhere. First thing I'm going to do is healing working for my nurse practitioner, because not only do I just adore her as a provider, she is all, I consider her a friend. So if anyone knows a type O kidney available, let me know. But so that's the first thing I'm going to do. The second thing I'm going to do is I'm not going back to that doctor. What I did was, so my husband told me there's another nurse practitioner at the practice who might be better to see. But what I did was I called my pharmacy and I messaged my pharmacist friend, and I asked them if they know of any providers in our area who provide the same kind of protocol for adult ADHD. And guess what? They can tell you. They can recommend providers. Switching practices entirely is plan B. And then I'm going to go in and get the hormone test on Wednesday. Whatever it says, I don't care. I'm going to take those results and I'm going to book directly with a hormone doctor or a hormone replacement place. And I'll probably have to pay out of pocket for that, but it's, my best option, and it's probably where I'm going to be taken seriously. So the second that I had that moment of feeling powerless and frustrated, I immediately took that and said, no, I'm not powerless at all. I don't have to stay with this doctor. I don't have to listen to that doctor. and I can find what I need. So sometimes witchcraft is that. It is just owning your destiny and your outcome in your life. And just because you come against opposition in some way doesn't mean that you are stuck there. And we don't need to, sit back, pray to God about it, or ask Jesus for the answers. Because guess what? You are the answers. You are the one who's going to go out and find the solution. It requires action. You can hope until you're blue in the face, but if you don't get off your ass to do something about it, nothing's going to happen. And that's why in witchcraft, I feel like that's where the shift actually happens, because we stop feeling powerless and like things happen to us, and we start taking control of what happens to us and taking accountability for ourselves. I feel like as witches, once we start to realize that, things just change for us. So I might be taking that doctor's name and putting it in my spicy black book. The nerve. He's probably judging me, to be honest. A lot of the doctors around here went to the Southern Adventist University, so the joys of living in the South. Anyways, all I'm saying is you're not powerless. You don't have to pray to someone else. Fix it yourself. I'm gonna fix this problem myself anyways. I will find the right people to help me. I will find the right providers, and that's it. They can't tell me no. So yeah, that's your daily dose of witchy motivation. Hope that helps.